Nice to meet you.
Still here.
You are.
All right.
Yes.
Well, good afternoon. We're going to spend most of this session talking about getting people back to work, and in particular, our barbers, our hair and manicure salon workers and the like. We're going to offer for the next 3 days the Abbott 15-minute test. Anybody who works as a barber, hairstylist, or manicurist. And I'm going to encourage everybody to come take this test, and I'm going to take one myself so you can see how it works if there's some kind of fear of the unknown. And so Anna Curran, our nurse practitioner, is going to turn the test on to get it started. And in the meantime, Chief Craig's going to give us an update on what's going on in the Detroit Police Department.
All right. Thank you, Mr. Mayor. As you all know, yesterday we celebrated the life of Corporal Waldus Johnson. He was a 16-year veteran of the DPD. And almost 3 years ago, he was wounded and succumbed to his injuries on May 31st. During his homegoing, we certainly celebrated his life. He's well known as a boxer. I didn't really know, and I asked his wife if I could go around with him. He said, well, he wouldn't be standing right now. But he was in the Army, a veteran, but really we recognize him for his leadership, his commitment to the city. He was well respected among his colleagues, and so he's going to be missed. The other, just to kind of give you an update, as you know, over the last days, 6 days now, we've had peaceful protests and no arrests. So once again, I applaud those protesters, the peaceful protesters who are out there getting their message out. Again, I want to give a big thanks to the men and women of the Detroit Police Department who really, for now, over a couple of weeks, have worked diligent in making sure we're keeping the city safe. So with that, I'll turn it back over to the mayor.
I also want to add my thoughts to the Johnson family. 3 years ago, the chief and I were at the bedside the night that Officer Johnson was ambushed, and the family has been through a very difficult 3 years, and just wanted to know how much our thoughts are with them. So I'm going to go back to showing you the charts that we have used. Anna, will you let me know when the machine is ready to start the test? Is it ready? Okay, so here's what we have got. We haven't done this in a while, but again, I want to show you the progress the people of this city have made, the daily charts. You remember the days when we were losing 40 and 50 of our neighbors a day, and we have dropped to 96 a week to 69 a week to 9 in the last 7 days. The social distancing embraced by the people of Detroit is extraordinary. And that's put us in a position this week where we open restaurants. On Monday, hair and nail salons and barbershops are going to open up. These constitute the highest risk of spread because you are in very close contact, potentially sharing airspace with your clients. And so we wanted to open up Friday, Saturday, and Sunday, the opportunity for anybody in the city who's cutting hair, styling hair, doing nails, to come in Friday, Saturday, or Sunday and get an Abbott test. And so Anna Curran is going to do the test for me right now. You get a sense of how this works. Every one of us up here has had this Abbott test, most of us multiple times, and so it's something we're very familiar with. But I want you to see how easy it is, and I want the public to hopefully go to their stylist who will use it. So we'll let Anna do what she does.
So it's got about 18 seconds left, and then it'll be good to go.
So ahead of time, I did enter in your name, your birthday, all of that information. And that's something that when these folks come to from the barbershop, they'll do at the Detroit Health Department. So it's now beeped, it's warmed up. And the stuff I'm doing now is just kind of a little bit of technical stuff here. This is the swab. It's basically just a Q-tip. Looks like this. It only has to go in about ½ inch into the nose. So it's very non-invasive. It's really simple, very easy. It's going to take in total about 10 seconds, 5 seconds on each side of the nose. It's 5 seconds on the first side. I'm going to go to the other side. Okay. And then I have to swish it kind of in this little media here for about 10 seconds. Throwing this in the little biohazard bin down here. And now I'm taking the sample and basically transferring it into the thing that's actually going to read it.
And this will take how long?
So entering the information and all that kind of stuff ahead of time takes a couple minutes. And then once you close the lid, it takes up to 10 minutes to get a result.
So in 10 minutes, we're going to find out together whether I'm positive or negative. If I'm positive, this will come to a quick end, this press briefing. But if I'm negative, we'll finish it all the way out. If I'm positive, Denise, you take over. As I said, each of us, we've now done 10,000 tests on this machine. Each of us has been tested at least once, and a number of us multiple times. Glenn Tolbert, the president of ATU, the bus drivers union is here, was the very first person tested on this machine the day we got it. He's going to tell you his story, but we have enormous confidence. Every member of the police department, the fire department, DDOT, and most other city departments back to work, nearly all of them have gone through this test process. Here's what's going to happen on Monday. The barbershops and hair and nail salons can be open. They are the highest risk of spread. Right now, we are running in our tests a little less than a 2% infection rate. What that means is 1 out of 50 people in southeastern Michigan is positive today. So if you're a barber and you're interacting in the course of a week with 30, 40, 50 people, 50 clients, chances are one of those people you interacted with has COVID-19. Now, if you're in a mask and they're in a mask, your chances of not getting it are quite good. But if you're going to see 30, 40, 50 people, you need to be careful. Think about the flip side. If you're the barber and you're positive and you're seeing 30, 40, 50 people in a week, you have potentially spread that disease to a large number of Detroiters. And so the city of Detroit is doing something, as far as I know, nobody else in the country is doing. But we are going to try to keep our residents safe. We know that if you're African American and get COVID-19, you're 2 to 3 times more likely to die than Caucasians. And so Detroit has been at the forefront nationally. And so here's what we're going to do. If you are planning to start on Monday and you work at a barbershop or hair or nail salon in the city of Detroit, you can get a free test. You can do it Friday or Saturday from 11 to 6, Sunday from 8 to 4. You can get your test before you go to work on Monday, and it's right across from DMC at Woodward and Mack. You have to have an appointment. We got 15 of these machines. We have plenty of people who can do it, but we need to have you scheduled. Everybody can't show up at once. So if you call the number 313-251-4488, you can call right now. Hopefully we're answering the phone. I'm pretty sure we are. And you can book a time Friday, Saturday, and Sunday. We just want your name, your email, your phone number, and where you are in Detroit. This is for Detroit companies only. So this is if your business is in the city of Detroit. If you're going to work at a business in the city of Detroit, you can get a test this weekend, and you can tell your clients as they come in that you've got a negative test that was just taken. And so if you value, as I know our employees do, you value the safety of your clients, you'll want to show them. In fact, I'll show you when I get the little printout here. Hopefully it'll say I'm negative. You will be able to post that, and you can show people what day you tested negative. And if you want, we will offer you a retest every 2 weeks. You can come back for free to the health department, and we will retest you. We know what's going to happen as the economy opens up. We've taken these lines down. They're going to come up a little bit, and that's all right. What we can't have happen is have them spike back up the way they were in March or April. And so just because you are negative today doesn't mean you're negative tomorrow. But if you want to come back every 2 weeks, you can make an appointment. And I want to have the one city in this area where if you go in for a hair and nail appointment, you know that the people servicing you have up their sticker, and they can tell you exactly when they tested. So the results will come out. The sticker will look like that, as you'll see in a few minutes. And so you come in. It was as quick as you saw. You're in and out in 30 minutes. You'll have a sticker that comes off. If you test positive, and Glenn Tolbert will talk about that experience, we have nurses on site. We'll give you a consultation. We will get you right to the proper medical care so that you know, but it also will allow you not to be infecting people in your life. The other thing is, if you come in this weekend, we'll give you a small PPE kit, so you could have a face guard, a couple of surgical masks, a couple of gloves to get you started. So not only will we test you, but we'll at least give you some PPE, so when you start seeing your customers on Monday, you are prepared. We did this a couple weeks ago. When the first round of business came in, we passed out 2,000 sets of gloves and masks and sanitizers to the businesses that opened in this city. And we're continuing to see an extremely low infection rate, even today. Again, extremely low. So far, we've opened businesses in this city in a very safe way. Restaurant seating. I think it's already hit social media, but Governor Whitmer and I today had lunch at Good Times on the Avenue on Livernois. Lots of people stopped by and waved, and from a little bit of a distance got pictures. But under the governor's order, the restaurants can only operate at 50% capacity. It is a whole lot easier for restaurants to get the kind of tables and customers they need if they can move outdoors. And City Council deserves enormous credit on this. Council President Brenda Jones and Council pushed this through quickly. It used to be a several-month process to get a sidewalk permit in this town. We probably should have fixed it a long time ago, but we fixed it now. And it's now basically 24 hours. And so we've issued 56 sidewalk permits already and approved 5 street closures. So all of these businesses that are up here now have, 56 of them already, have sidewalk cafe permits. And so as you go around this city every day, you'll see more and more restaurants putting in these outdoor tables. You'll have a choice of sitting indoors or outdoors. But we have to get our businesses back earning money, and we have to get the employees in this community back to work and do it safely. And so I'm really pleased at the way Ron Brundage and the team at DPW have handled this in getting these permits done. We've had 5 street closures approved so far. So Shelby and Capitol Park has actually been closed off. Those of you familiar with Grandma Bob's up at Michigan and 14th, they asked to close off the alley behind their restaurant, which we've approved, and I'm sure will be operational next week. Eastern Market has brought in 3 requests that have been approved, 2 blocks of Riopel and 1 on the Gratiot Service Drive. So the early requests we're getting are not really disruptive of residential neighborhoods. If we get into requests that do involve traffic flow to residential neighborhoods, we're going to have conversations with the neighbors first. But you're going to start to see more and more small street areas be closed off. And I hope that we will go out and patronize our fellow Detroiters and their companies. So that is what we're doing on that side. This is all possible. We are able to reopen relatively quickly in the city of Detroit because of the extraordinary success we've had at knocking down COVID-19. And the person who's been leading that effort is our health director, Denise Fair, and I'll turn it over to Director Fair at this time.
Thank you, Mayor. And it looks like you only have about a minute and 15 seconds until we determine whether you are positive or not. And things are looking up from here. So as of today, we are now seeing 11,294 cases and 1,416 deaths. Now, the number of new daily cases is hovering right at around 20 or so, half of which are asymptomatic. So these are people who are testing positive and they don't have symptoms. We're also seeing that 20% of the newer cases are coming from those in their 20s, which is much higher than what we've seen to this point. So we at the Health Department will continue to monitor our data. And if you are watching and you are a resident, I encourage you to go online to our dashboard at detroitmi.gov/health so that you can see the data for yourself. Now, I do want to talk to the salon and barbershops and nail salon owners. We're all excited that you are going to open on next Monday. And I do encourage you to get tested at the Health Department. The process is really easy, as Mayor Duggan has shown you. Now, when you do open next Monday, it's really important that you practice these safety precautions when you are interacting with a customer. So first, avoid walk-in services and consider limiting services to clients by appointment only. Adhere to social distance guidelines. So for instance, ensure one empty seat is between each guest in the waiting area and also in the salon chairs. You can also consider closing the waiting areas and try to keep clients from entering their salon before their appointment. Also, check the temperature of your staff and even your customers before they enter the building. Another idea is to use touchless payment options. Finally, have an abundance of alcohol-based hand sanitizer at stations around the shop for your customers. Wash your hands in between each client with soap and water. Make sure you clean those high-touch and disinfect those high-touch surfaces. And finally, require all of your employees to wear masks and a face shield like the one that you will get if you come this weekend to the Health Department. You will get a PPE kit with this face shield as well as 2 N95 masks. So it's really important that when you are providing service to wear the face mask, which is right here, and also the face shield, really simple to apply. This is how you will be interacting with your customer at all times. So again, this is the face shield that you will be required to wear and also the N95 masks. Finally, it's so important to be transparent. Post signs. Email your customers now and let them know the precautions that you are going to take to ensure their safety. So again, if you do nails, if you cut hair, if you braid hair, even if your salon is at your home, please get tested. This is going to help you and also protect your customers. And so with that, I'll turn it over to the mayor.
All right, so Anna, we're going to get the verdict here.
You are negative.
I'm glad to hear it.
So typically when you come into the clinic, we print out 2 of these. One, the clinic keeps and gives to the people we need to at, the health department, that sort of thing. And one goes home with you so that you have your own proof. Go ahead.
So thank you to Anna Curran and Henry Ford Health System, which has contributed Anna and a lot of other staff who have been fighting this. And so I've got a little piece of paper that tells the date, and it says I'm negative. And I would encourage our barbers and hair and nail salon workers, tack this up, or it's a sticker. You can pull it off and stick it up. But I would love to see the culture of this city that when you go in to your hair and nail salon, you say, hey, when were you tested, and do you have the result posted? We have to keep the spread of this disease down, and nobody wants to be 3 or 4 weeks with the governor ordering the closing of hair and nail salons again. We don't want to have to go through that. I know the governor doesn't want to have to go through that. And that means that we have to make sure that we do this safely. There has not been an issue, I shouldn't say no issue, but the biggest service issue that I've heard in this city in the last 3 or 4 weeks are people continuing to talk to me about how crowded the buses are on DDOT. And so Glenn Tolbert and the drivers union had a very reasonable request on March 17th. We stopped collecting the fares. We had people board and deboard at the back of the bus. We closed off those front rows. For the most part, that worked out okay, although it pushed the passengers to the back rows of the bus. On most routes, that wasn't an issue, but on some of our busiest routes, it became quite crowded, and I've had lots of reports of folks standing at the bus stop. The driver goes past them because the bus is already full. And so Mikel Oglesby is here to talk about a significant expansion of DDOT buses. We are doubling the buses during rush hour on our busiest routes so that you will not be crowded in together. He's going to take you through that. And then in partnership with ATU, they have come up with a plan where we are ordering driver shields around the driver's seats that we expect will come in later this year and be operational by next year, that will protect the drivers from the comings and goings of passengers and the spread of germs, which will mean we'll be able to open the fare box. It means you'll be able to sit in all the seats. But that's probably not going to be until after the first of the year. So for probably the most, if not all of this year, what we're going to do is keep adding buses to the heaviest routes so that you are not crowded in together. And to talk about the short-term and long-term plans for service, we have Mikel Oglesby, the new director of DDOT.
All right, thank you very much. You know, it's been a challenge trying to practice social distancing, and the mayor basically said it in a nutshell. We have to do something, or we had to do something to stop this overcrowding. So what we did is we took the Saturday service schedule that we had implemented, and we doubled the amount of service during the peak periods, the times that people ride at the most amount of time, which is typically between 3 p.m. and 6 p.m. in the afternoon and 6 a.m. to 9 a.m. So we doubled that service, but we took it one step further. Not only did we do that, and this just happened this past Monday, is we also are looking at things real time. In other words, making adjustments on the fly. We have road supervisors out there. We have our data, all of our data basically tells us which stop is crowded, and dispatch together with the drivers all speak. So we're all talking real time, and if we see a location that a stop has too many people, we will instantly send a bus over and offset that. So we've been doing it so far. It just started Monday, so we're going to see how it works out again. From the data and information that I've seen so far, and I've been out there looking, it looks like it's working. But the great thing about doing it on the fly is that if it's not working, we can add more resources. So that's what we basically did. We did it on the 6 routes that had the most frequency. And
why don't you list those routes?
Sure. Woodward, 7 Mile, Gratiot, Grand River, Greenfield, and Warren. They're right there. So if people are wondering, well, how do we know when the bus is going to come now? I'm kind of confused. Well, on these routes, we're running the regular weekday schedule. So there's 2 ways to do it. 1, you can look at the old original schedule for those, or 2, take a look at the transit app, and between those 2 you'll be able to get the information. At the same time, we'll have customer service taking all requests. In addition, there were 2 other routes that were really affected by increased ridership. Who would have known? We took a look at the data, and Dexter and 8 Mile needed some more service. So what we did is we are going to be providing transportation every 25 minutes, and we'll be adding additional service as needed. So between those two, we're going to watch, we're going to see how we're doing, we're going to listen, we're going to tell you we hear you, and then we're going to continue to adjust. So this is how we're going to do it, and the only way to do it is to work together, not only with the union, but with the riders, so the drivers and the riders. Would you like for me to go into this part, or you got it?
Go ahead.
Okay, great. Well, you know, it's really exciting. When I first got here, I said safety first, and we need to figure a way to take safety to the next level. I mean, you've heard safety first, but we want to amp it up a little bit. So I worked very hard with President Tolbert on a solution that will allow us to eventually get to the point where we can collect fares, but more importantly, protect the driver and protect the passenger. The way to do that is with a safety barrier. So there is an incredible safety barrier that we're going to be getting. It's top of the line. It has a separation between the rider and the driver. It actually has an electric window, you can't see it there, that goes up and down. And it also has 2 fans that blows air in and out. We're in the process of getting these on board and getting them ready. Once we install these, we'll be able to start talking about collecting fare, but more importantly, the real focus is safety. So we can't wait till this happens. We're looking at a time frame towards the end of the year, actually the beginning of next year, because it takes time to install these and we want to do this right. So if anybody says, oh, they're putting these barriers up, are they going to be collecting fares right away? No, we are not. We are not going to collect fares until the mayor says we're going to collect fares, and that's that.
So we have done this in partnership, and a number of you remember on March 17th when the drivers did not leave the terminals, and I went out and sat down with Glenn Tolbert, the union president, and they convinced me that the issues they had were legitimate. We were going to address them together. You've seen a level of cleanliness in DDOT buses that are probably you haven't seen in most folks' memories. We've had better protection for our drivers, but one of the things we talked about that day was, did the drivers want a door? And the feeling was that there wasn't really a product that drivers felt comfortable with. You get in and out quickly. And so before we did anything, we wanted to vet with the drivers themselves, is this something you want? And I'm glad to say that the ATU president is here and is sitting with his fellow COVID survivor, Chief Craig. And with that, I'll turn it over to Glenn Tolbert.
Good evening. Well, I think I first want to start with telling the men and women working in the salons that the testing it's gotten a lot better since I was the first one to use that, the 15-minute machine at the health department, and it was rather uncomfortable. But now, as you just saw, it's a lot easier. There's a swab right in the nose, and with me, they seemed like they were up in my eyeball. But it's a lot less uncomfortable now. So I encourage everybody to get it. I mean, you may think I don't have any hair, so I don't go to the barber, but I would feel a lot more comfortable when I did go to the nail salon or that the techs are COVID free. I mean, this is serious, and I don't think a lot of people are taking it serious. As the mayor mentioned, on the 17th, to the mayor's credit, he met with us. He didn't come in telling us we better go back to work. He listened to us, and he did what we asked him, the reasonable things that we asked him to do. Along with Mr. Berry, they came in and they listened to the drivers' concerns, and they met them. And we've been steady trying to get them to do more and to protect the drivers and the passengers alike. And with this door, this is one step in the right direction. So we're going to steady be improving and trying to do it. But I want to tell my story. Like I said, I was the first one to get it. I didn't have any symptoms except a cough, and I didn't think it was bad. That's why I'm sitting up here now trying not to cough, because the last time I coughed, the mayor insisted that I go get a COVID test. You know, I told him I was fine. I thought it was the normal allergy season that comes along, and you get the coughing and sneezing or whatnot. I didn't have a fever. I didn't have shortness of breath. Never did. And the mayor insisted. I told him no. He insisted. I thought I better go before he had Chief Craig come get me. So I did go, and I'm glad I did, because you don't want to take that home to your family. You want to make sure if you can do something about it. So a lot of times in our community, we don't want to know. I think you want to know this. And everybody in our community, the Detroit community and surrounding areas, have had somebody that's been affected by this COVID thing. I mean, it's not like nothing I've seen in my 54 years. So it was unexpected, and I think, along with the mayor and the city, we handled it very well. The doors, and I want to appeal to the passengers. The mayor has done something, and I'm not going to take credit for it. We've been working together to make it safer and safer for the bus. Closing the front door, getting the social distancing together, stopping the overcrowding. And the mayor took it upon himself to put masks on the bus for the passengers. And I want to appeal to the passengers. They're there for you. And you don't need but one. You don't have to take 5 or 10. There'll be some there tomorrow. Take and wear it so that you can protect yourself and your fellow rider, as well as the driver. So, having said that, I'm looking forward to these barriers. This is something that's been coming for a long time. We've been trying to get, under former President Henry Gaffney and Fred Westbrook, former President Fred Westbrook, who indeed lost his life in the COVID fight last week, and Brother Jason Hargrove, one of my members who lost their life. On behalf of them, I appeal to you to do your part. Do what you can. We can't walk around worrying, but you have to do your part. I don't worry about it. I'm a survivor, and I'm a COVID survivor, and I do what my part by washing my hands, by social distancing, by wearing my mask, and I encourage everybody else to do it. And help your fellow bus drivers, because we need them out there. In order for what the mayor and Director Mikel suggested to work, I need the drivers at work, and we don't need them getting sick and going out. So I need you to try to do your part to make sure everybody's coming to work, and we're doing, because we've made sacrifices since this thing started, being out there, and we're going to continue, the men and women of DDOT and Local 26 ATU, we're going to continue to do our part. We need everybody to do their part. Thank you.
Thank you. So you can see how we're bringing the economy of the city back to life with the highest safety standards. We are not going to shut down again. We're going to do this the right way. With that, we'll take any questions.
Good afternoon. ML Elric, Detroit Free Press. Chief, you started this afternoon talking about the loss of one of your officers, and I wonder, when you think about all the officers who have fallen in the line of duty and who have made the ultimate sacrifice, and you hear protesters say what they say about police, how does that strike you, and how do you deal with that?
We're professionals, and it's not easy. I'll be candid. After 44 years in this business, and when you know that the men and women are out there putting their lives on the line each and every night, I think what was most telling to watch them when they were on those front lines and they were being, projectiles were being hurled, and they didn't relent. They stood fast. They didn't say, look, I don't want to do this any longer. I've heard some of the horror stories in other parts of the country, but the men and women, we're very unfortunate, the police department that we have and the quality. They want to be there to serve. It's not easy. I know it's not easy. But we continue. Even one protester said, look, I know it's not easy for the officers to have these insults hauled, but they know. They just keep moving. And then the other part of it, we're human. And so when we see a partner, one of our partners is getting a little agitated, it's important to pull them out so they can take another breath, because we're human. And so that's the real reality of the work.
some folks have noticed the badges around town where officers have fallen. Do you know whether any of those have been defaced or vandalized in any way?
You say badges around town, I'm not sure.
The blue signs where it'll show where an officer was.
The secondary street names.
Oh, yeah, secondary street. I've not heard of that. Have you got information that that's?
No, I just I know that that they're popping up in neighborhoods. I don't know if you've had any reports.
I have
that
not
anybody's
received
interfered
one
with those.
report.
Okay.
Yeah.
Okay. Speaking of the officers on the line during the protest, do you have any figures? I guess I'd say figures to date, since it seems like we still have marches, but of officers who were injured since the first march on May 29th?
I'm going to say probably 4. I mean, certainly one that comes to mind is the captain who suffered a concussion after being struck with a small boulder. Another one's shoulder was hurt. Another one had pretty significant leg surgery from a fall. And during the fall, he had to get surgery on his leg. And there was one other. That's the ones that come to mind. I might be pretty close on that.
Okay. And any update on the status of the investigations into officers whose conduct may have raised some questions about whether they were following protocol?
Yeah, it's a very high priority. We're moving forward. I'm getting daily briefings. Some of the officers involved in the alleged misconduct have been interviewed, some, not all. So we're making good progress. I'm very satisfied where we are with the investigation.
So still ongoing for
It
those?
is still ongoing, yes.
And does the department keep track of any total numbers or running numbers of marchers, protesters, demonstrators, if you will, who have said that they've been injured or who have filed complaints?
Well, we absolutely, when we take the complaint, of course, some of them are going to the Office of Chief Investigator of the Police Commission, some come to us. So when they come into us, of course, we open a complaint investigation, and it's a numeric tracking system. So that's being done. And so every day we get one, and someone might send us a video. It may be a duplication of what we're already investigating. But every person that sends us information about an alleged misconduct, we open an investigation or determine whether or not it's a duplicate.
Okay. Do you have a rough number or a sense of how many of those have come to DPD at least?
I don't have that number. We can get that. We can check it through our database and professional standards, but I can't speak to what number of complaints are going in the commission. You might have to check with the commission on that.
Okay. And as much as I obviously am concerned with the barbers coming back, I wanted to touch base with you on what we heard from the demonstrators, since we haven't had a chance to see gentlemen since the meeting on Tuesday. And one of the things that Tristan Taylor had said is that one of the reasons why police decided to make arrests for curfew violations on Tuesday was that you had intelligence that there may be weapons among the marchers. Is that an accurate recounting of that conversation?
A more accurate statement is that our officers were attacked over the prior 3 days at different points. That was based on what we saw and what we knew. And so it wasn't like it was information that we just heard about, and so we decided to make arrests. Our officers were attacked.
Okay, but so there wasn't a specific intelligence on Tuesday that said there may be something going on within that mass of people that may ignite?
Well, it'd been rough for the prior 3 days.
Sure.
I mean, so I don't recall getting anything specific.
Okay.
We may have. A lot of it was we were closely monitoring the protesters, and certainly on some days we saw that there was significant agitation. And again, I think I reported out maybe last week where the day I decided that we wouldn't enforce, there was a different spirit among the group. It was almost celebratory. And so it was in my judgment, based on what I saw, based on, we'll use the word intelligence, that we didn't think that it would be a violent protest.
Okay.
And so use a discretion not to enforce the curfew.
Okay, and this is his characterization, so we want to do our best to get
Right.
all parties to...
It's not an accurate characterization.
Right.
Okay. So, Mr. Mayor, can you talk a little bit about what happened during that meeting on Tuesday? I don't know if you've heard some of the things Mr. Taylor said coming out of that. I can certainly relate some of them, but what was your impression?
Well, and the conversation was actually not a lot different than the conversation they had at 4 o'clock with their other protesters. You know, I have enormous admiration for the commitment of the folks who have gone out, and they're raising their voice to change systemic racism and criminal justice in America. But what I pointed out to them is there are a lot of other protesters too. The 4 o'clock group is not the only one. We've had thousands of people out at Belle Isle on the DeQuinder Cut on Saturday. We've had high school teachers. There have been a lot of protests, and because this particular group that leaves at 4 gets the media coverage because of the drama, the curfew, I think there are a number of groups in the city, and you saw that, who feel like this group is somehow the spokesperson for all community activists in Detroit. And our point was, we respect what you've done. We want you to be a part of change, but there are a lot of groups in the city who have been working for a long time on police-citizen relations, the Detroit 300s, the National Action Networks, the Tafari Brents, the Negus Vus, the D-Live groups, and many of them. What we said is, if you want to be a part of this, your contribution will be respected, but you can't displace all of these groups. They raise the issue of evictions. We've had 40 organizations that have gone door to door in the last 3 or 4 years to keep people in their homes, get them property tax exemptions, get them into payment plans. We're in meetings by the day to get $2 million out to lawyers to fight landlord-tenant cases when the court reorganizes. And you got people like United Community Housing Coalition and Ted Phillips and Michelle Oberholzer or Linda Smith at USNAPAC. We said, look, your group has not been out at the dining room table helping people get into these plans and avoid it. But if you wanted to devote your efforts, they would certainly be welcome. But I wanted to be clear, I spent 2 hours with them, and I listened and I learned a lot. But I also said that there's an impression from the way the media is covering that this group that starts marching at 4 o'clock represents all community activists in Detroit, and they need to be a part of this. And I think that was the nature of the conversation. Whether they like that or not, I'm not sure, but I think you saw later on that what Chief Craig and I are hearing from activist groups around the city saying, why is the group that starts marching at 4 o'clock the one that's acting as if they're representing the city on these demands? I think there's a lot of folks who feel like they've been putting years of work in, and I wanted to make clear that the folks who have been here are not going to lose their seat at the table.
Sure, and the Free Press has been at the DeQuinder Cut, and we're going to be somewhere, I think, at 4 o'clock today, so we've covered as many as we can. The protesters did say that they thought you were there for an hour and then had to leave, not 2 hours.
I was there from 10 to 12. I think the chief left at 11:30. I left at 12.
Okay.
No, the Conrad Mellon and some of the others stayed beyond after the time I left.
Okay, and I think what they related at their gathering was that impatience, and that they were told you can be on this committee or we're already working on this, and there was some outreach from the city to say here's where we are on the issues that you are concerned about, but their feeling was that it sounds like they're going to try and move forward on their own. What do you make of their ability to impact city policy going forward with that attitude?
You know, I think the people of this city strongly support their efforts and their message to change the criminal justice system in America. When they take a position that we should get rid of green light, the great majority of community activists in Detroit don't agree with that. Green light is a product of community activists. It was neighborhood group after neighborhood group going up to their party store in their gas station. In a number of cases, neighborhood groups marched on gas stations that were unsafe until they put in green light. So when somebody says, I'm speaking for Detroit, and you've got literally, we had 700 green lights, almost all of which came about because of neighborhood requests. Again, there is a feeling that says, and this is what I try to say to them respectfully, you can't displace the people of this city who have been at the table and working on these issues, you should be a part of it. I know they didn't like that, but the fact that they start marching at 4 o'clock and they get TV coverage because of the curfew does not displace all of the residents of the city and all the activist groups that have been working for years. And so if they dismiss that as I said they had to be a part of a committee, that may be their interpretation. What I was saying is you need to be respectful of the groups in the city who have been working hard on these issues for a lot of years.
Okay, and Mr. Mayor, last question on this topic. You had, at least from me, you had said before the meeting, one of the things you were curious about is whether or not this would be an all or nothing type of meeting, whether you'd find some common ground and some issues where you might be able to work together on. Reflecting on that meeting, where do you see it now?
Again, we'll see. The list of 23 demands they handed us at the meeting did not include getting rid of the cash bail system. And I was surprised at that. And I asked him why. To me, that's one of the most fundamentally racist parts of our criminal justice system. Why isn't it on the list? And basically I said, oh, they forgot, was their answer. But my point really is this, that their group has a significant number of people outside the city of Detroit. Something like changing the cash bail system is going to require a change in Lansing. They could be extremely effective allies with Detroit legislators if the people in their group were all lobbying their own legislators in surrounding community. And we talked about the fact that if we work together, we could potentially get fundamental change in Lansing, and they seemed interested in that. But again, so I think there are areas where we agree. I told them if they would put their energies, we're going to have a whole lot of people facing eviction coming up. We got a whole lot of people who should not be paying property taxes with the exemption, where we're going to be knocking on doors and sitting down in living rooms. I said, if your dedicated marchers would be willing to make that same commitment to go into people's homes and say to them, here's the lawyers that we can get you to protect your rights. Here's the option you have if your landlord doesn't have their house up to code. Here are the payment assistance we have. If they would put that same energy into going into the homes of residents of Detroit and helping, they could be an enormous asset to helping people in the city. And so I asked them to consider that. They may have taken that as I don't want to be part of a committee, but those were the kinds of conversations we had. They didn't leave. It wasn't unpleasant as people broke up. It was professional, and they said they'd get back to us. So, I think there is potential for us to do things together. As you know, they've got their own issues with Detroit groups right now for the reasons that, I think was very predictable.
Okay. And in terms of returning the buses to full ridership, for either the union or city officials, is there a concern that if people are sitting side by side on those buses that they may spread the virus amongst themselves, even if the drivers are sequestered?
Yeah. If they're wearing masks, that concern is far less than if they're not.
Okay. Okay. And is there a way to monitor that, even if that
Denise?
leads to any sort of spike or?
So we are continuing to look at the data on a regular basis, and I believe at this point, as I mentioned earlier, that our number of cases are still hovering around 20, and we have reopened the city, but we have not seen a spike yet. It's going to take a little bit of time before we do see one, and hopefully we won't. But as the mayor did indicate, that if you are wearing a mask, if you're practicing social distancing, we shouldn't see that spike.
Okay, great. Thank you very much.
Mayor, if I may.
Sure.
Furthermore, I don't believe that, and I hope I'm not mistaken, that we were going to full capacity anymore. We're still doing the social distancing. We're limiting the passengers. So, I think you heard that we were packing the buses. That's not true. We're doubling up the service so that we don't have to do that.
I'm just looking at the graphic that says all passenger seats will be reopened, so I don't know if.
So we're talking about next year after the shields are in, and we will see what kind of a situation we're in. I will talk longer than anybody wants to know about projections of what happens next December during flu season, and we're going to be spending a lot of time talking about preparing the city for that. But we will make the decision appropriately. But I do expect sometime next year we'll be back to full seats and back to fare boxes. Is that January? Is that April? I don't know.
Okay. All right. Thank you.
Just two brief questions. One from Bridge Magazine. This is for the chief primarily, but also for the mayor if he wishes to weigh in. Want to know if the recent events with the protests changes your thinking at all in terms of receiving U.S. Department of Justice money for the Operation Relentless Pursuit.
I'm confused with that question because, in fact, what I do know, I've gotten feedback through the U.S. Attorney's Office that General Barr was praising how we handled the protests here in Detroit. As you know, we were one of the few cities, I think Boston may be the other one, major cities that didn't see large-scale looting, property damage that you saw in other cities. So that's never been...
And I don't think we aren't directly funded by that, are we?
No, we're not directly funded.
So it's not a matter of accepting funding. As I understand it, they were talking about spending money within federal agencies. To my knowledge, it was not money coming to the city, right?
Yeah, I think that there was some talk about maybe overtime, but it's not even there now. It's really funds that are going to the U.S. Attorney's Office and maybe bringing in additional agents on the ground to work with our officers, but I've not heard that.
Okay. And then for Ms. Fair, last question for today. Louis Aguilar from Bridge Detroit wants to know if you can share what the infection rates have been at the senior apartment buildings.
Sure. So just for some history, middle of April to the end of April, our first round of testing was about 24% for the nursing homes. So far, now we're at about 5 to 10%. Starting tomorrow and for the next week, we're going to test 7 facilities, so 7 nursing homes. So we expect that the infection rate will be much less. We're going to test those 7 facilities that have the highest the highest mortality, as well as the highest number of cases. That's where we are for the nursing homes. For the senior apartments, we're nearing completion of testing about 70 facilities, which is almost about 4,000 seniors, and we're still at 1%, which is extremely low, and I'm really proud of the team and the work that they're doing.
All right.
All right. Thank you very much.